It's a scary thing to think about, and even more frightening when it is a diagnosis of someone you love. Alzheimer's disease causes mental decline that's more than forgetfulness. People forget everyday activities. They forget loved ones, and eventually it's just like their body forgets how to live. For caregivers, it can be extremely difficult. Here to dispel myths and give us some facts about Alzheimer's is Dr. Donna Raziano of Mercy Health System. Dr. Raziano, there are, I think, a lot of middle-aged children who see their aging parents and they see them being forgetful, and they think, goodness, that's dementia. But is dementia Alzheimer's? Break it down for us.
Sure. Alzheimer's is the most common type of dementia. About 5 to 10% of mild cognitive impairment or early memory loss will progress to dementia every year. That is quite a small amount of general memory loss.
Okay, so that's general memory loss, but is that Alzheimer's?
So no, it is not. And Alzheimer's is very distinct, more moderate to severe memory loss. As you progress with your memory loss, it becomes harder and harder to do daily functions. It might even be difficult to brush your teeth because you can't find the toothpaste to put onto the toothbrush. Even minor household activities can be quite challenging.
Mm-hmm. Okay, so we oftentimes think that there are the people who develop Alzheimer's or who develop severe cases of dementia are older people, but that's not necessarily the case?
Correct. About 5% of Alzheimer's is under the age of 65.
Mm-hmm. And so is there a cure for Alzheimer's? We often have heard about certain drugs that might be really helpful.
Right. There is no cure for Alzheimer's. The memory pills, as we call them, will help protect the mind longer and try to maintain function in the community as long as possible. There are things like intellectual activities such as crossword puzzles, and physical education and physical activity can really help protect that mind. It is too late to start those activities as you hit moderate dementia. So the goal is to have a lifelong activity in both physical and intellectual activity for life in order to protect yourself.
Okay, so we talk also about caregivers, and Mercy Health System has a program called Mercy Life.
Yes.
So tell us about that.
Sure. Mercy Life is an adult day program that has full encompassing care, includes all medications. It's a day center with both recreational activities. There is a clinic with a nurse practitioner, a physician, there's nurses, recreational therapists. It's a full gamut of services that are fully comprehensive in what they can provide. It's actually a very safe place. The majority of the folks are late 70s. They want to live independently in the community, and they come to the center 2 to 3 days a week for activities. Mm-hmm. When they come to the center, they're engaged, they're entertained, and they're really seeing familiar faces, and we can maintain them in the community as long as possible. The Mercy Life program really prevents hospitalizations because we increase medication compliance rate from in the 40% national to over 80%. We decrease hospitalizations in half, we decrease hospital readmissions in half, and we prevent nursing home institutionalization.
Okay, Dr. Raziano, thank you very much. So for more on Mercy Health System, you can go to CBSPhilly.com and click on the Talk Philly.